My name is Budi, and I will be chairing today's session. People will still coming in, and that's completely fine. Before I officially welcome you, I just want to let you know that we are recording this session. So if you have a pop-up saying that this session is being recorded, please accept it. If you don't want your face in the recording, that's completely fine. You can just turn off your camera and we'll be okay with that. Let me just do that. And let me just share the screen. Just give me a second. Excellent. So thank you again for being here. This is the last ISSHN meeting for ISSHN for the year. And we're going to have a great list of speakers sharing what they've been doing in the past few years. But of course, before I start, I do want to acknowledge the traditional custodians of where we're all calling from. So I'm calling from the land of the Wurundjeri people of the Kulin Nation. I'd like to pay my respect to the elders past and present, as well as future leaders in the community. If you want to do your own acknowledgement, please use the chat function, and you can do that to acknowledge where you're calling from, because we're all calling from different places. Most of us are working from home still, so it'll be interesting to see where you are located and the country that you're from. So welcome again to ISSHN network meeting for the last one for the year. My name is Budi. I am one of the co-chair, and I have the other co-chairs with us today, Karina Reeves from Curtin, and also Ali Coelho from the Coelho network. I keep forgetting where you're from, Ali. And we are going to start the ball rolling. Again, it's towards the end of the year, so let's get things started. And we're going to have the first speaker, Professor Catherine Gomez, Kat, that I met when I was still an international student many years ago. I don't know. I still don't see you as a colleague because you are way above me. So I just kind of got, still feeling a little bit like, afraid of approaching you just in case you told me off. Then after Kat, we're going to have Associate Professor Catherine McPhail and Maddie Stratton, who's going to share with us their brilliant innovation with sexual health kit. And of course, we got Dr. Jian Trang, who's going to share with us as well all the work that she's been doing. We're going to have an update from COPAM. So Karina is going to give us an update about, something that just recently launched, Making Your Materials Work. That's very exciting. And for those of you who are been with us since the beginning of the year, there is a working group as part of ISSHN to work on the deed and Senate inquiry into the universal access to reproductive health. And Ali will be providing an update on that. Then we can all carry on and move on with our afternoon. So Kat, no pressure, but you are the first one on the ranks.
Thanks, Budi, for that. And hi, everyone. Nice to see you. And it's really interesting because, Budi, Ali, Shanton did a wonderful symposium a few years ago. I think before we started officially this afternoon, we were talking about it. And it's so important to have, the network to really educate, as well as to have a kind of people who are so committed, right, to such an important topic, especially with international students as transient migrants. And this is something that I've been really interested in clearly for a long time. And Budi, like you were saying, you are an international student, and so was I, right? And so part of our interests and, in a way, professional life commitment has to also do with our own identities, right, formerly as international students. So thank you so much for having me and for allowing me to talk about some of my work. But more importantly, this is not like classrooms, right, where I really strongly encourage you to interrupt me at any time. So please ask questions, whether or not as sort of like, yell at me or, in the chat, because I actually do have the chat open as well. So, do ask questions and do sort of like, engage, because that's the most fun and that's the most that we get out of sessions like this. So thanks very much for having me. So hi, I'm Kat. And it's lovely to see you. So many of you, some who I know well, and making new friends as well. So, and I'm also going to plug a couple of papers that Shandon and I have been writing. So Shandon's presence will still be here too. So hi everyone. So today what I'm going to talk about, could we have the next slide, please? Thanks. I'm going to talk about sort of like, international students during COVID. So the last couple of years have been, as we all know, difficult. But at the same time, for researchers like myself, it's also been a time where we're actually looking at new things that's happening. So the last couple of years, I've been running a couple of like little projects on the side, side gigs, right? To understand about how COVID has impacted on international students, because the last time, as we all know, the last time a pandemic impacted the world was 100 years ago, and probably there were 5 international students worldwide at that time, during the Spanish flu. But now clearly, it's so much more. And as we know, you're being temporary migrants, international students were either away from friends and family in Australia, or they were actually back home and away from even the support networks that they have in Australia. And so for quite a few international students, especially those from the LGBTQ A plus community, sometimes the networks that they need are actually not back home, right, but rather in Australia. So one of the things that I was looking at was trying to understand how has COVID actually impacted on their everyday lives, because everyday life is really very much impacts on your whole well-being, right? So I did a couple of projects, where one of them where we were looking at it's a bigger project, looking at 29 postgraduate students, of which 9 were international students, and another one which was where I was looking at about 8 international students, and a few were from the LGBTIQA plus community. And so what sort of like I saw was that students were in a situation where they've never been before, right? And it's a term that I've just coined called shock temporality, where when you think about international students here, that the whole idea of being an international student is that you have a finite period of time. So whether or not you're doing a PhD for 4 years or 3 years, or an undergraduate degree for 3 years, you always know that if you start in February 2022, you're going to end sort of like December 2025 or 2026. Yeah. But with COVID, right? People didn't know what the hell was going on. They didn't know whether, what's going to happen tomorrow. And everyone was, stuck in their own apartments. So for so many international students, they were in these rental apartments by themselves, or they were in rental apartments with a whole bunch of other people, so there was both loneliness as well as overcrowding. But one of the things that I've been finding was that, or some of the few things that I was finding was that, they were feeling the sense of, loneliness, this lack of sense of belonging. They were stressed out. There was disruptions to mundane life, and challenges, of everyday life still carried on, right? So, with PhD students, they were telling me things like, oh, what was happening was I was so I was so frightened about my examinations. On top of that, I'm wondering what's going to happen to my life tomorrow. And I don't know what's going to happen in my career. I always want to become an academic, but I can't go anywhere now. So it's those kind of issues. But if we whittle down to students who were from the LGBTIQA plus community, there were actually a few other things that were happening. So I interviewed someone who was telling me that, one of the issues that he found was that he could not find assistance for LGBTIQA plus international students anywhere on campus. So he did try, and he was feeling, this sense of, he needed mental health support, which he could not find. And really interesting enough, this particular person who was telling me about this, what he then did was he then sort of like got very much involved in trying to create mental health support, for his peers. And so he was trying to learn how to do this. So that was how he was coping with it. And I thought that was actually really interesting in terms of sort of like not just him creating avenues, but part of that was also helping himself with his own mental health support. And this is the thing that was missing, right? When the last 2 years, there's been so much of talk about, yes, a lot of international students were going through mental wellness challenges, because of the restrictions, because of being isolated, but at the same time, we were forgetting also on the greater scale that there are also communities within within that broader international student community who needed those kind of more specialized support. And so for this young man, that's what he was telling me. And he was also saying that he was really finding it really difficult to find those LGBTIQA plus international student communities to help with the issues that he was having. So what he was saying was that he felt really lost. He was finishing up his master's, and he was trying to find, and he was also coming out at the same time. So he was trying to find these communities that could help him, and he was lost trying to do that. And this is where it's really important, I guess, that for us to realize, working in the sector, that even though there are these communities of support out there, but people don't know, and that is the problem. And the challenge for us, right, is to figure out how are we going to communicate that these communities of support do actually exist, because so many people don't know. Even in my institution, it was so odd because my institution did not even know that there were, or at least in my school, that there was support, financial support for international students, especially in that first year. So it's about this communication. So this is where I'm going to plug one of Shenton's essays that's coming out in a journal that I edit, called Transitions, where he's actually talking about Chinese.
No, I went on it.
Oh, sorry. Oops. Hi. Sorry, did someone ask a question?
That's okay, Kat. Keep going. I think someone just the mute button was accidentally pressed.
This is the fun bits, right? Wherever we have these online things where we multitask. All good. So anyway, I'll just put the journal there. And so what Shenton was talking about was about Chinese men who have sex with Chinese international student men as well. And so and how there have been increases in HIV cases because of that. And so some of the core things that Shenton and his colleagues were bringing out was this issue of education, that people actually don't know, right? What to do, when to do. So those are kind of like the things that sort of like we're finding out in the last couple of years. And so one of the things that Shenton and I have also been working on, and Woody, if you sort of like click the next slide, please, is thank you, is actually creating resources, and this kind of like flags also later on to some of the wonderful presentations later on today about how important resources are, right? And so one of the resources that Shenton and I have been working on is how to actually create messaging around critical incidents for international students. So this is a project that Shenton and I have been working on for the last few years. And so we created 20 messages while co-designing with emergency services and with international students on how to actually design important messages for international students that international students will actually understand. So one of the ones I've highlighted here is about sexual health, right? And so some of the key points here is really about how important it is for student services to to educate international students about sexual health and at the right time. I think the challenge in our sector really is that we have multiple, we have different cohorts at different times, right? New cohorts just don't come every year, but they also come every few months. If we think about ELICOS, for example, and so for a lot of our international students who come at different times, they're actually not aware about how, about the services that are available for them and what to do sometimes, especially when it comes to sexual health. So these are the things that we are really interested in, and the challenge that we are really having is how are we going to actually communicate these resources to people, you know and this is where I guess sort of like is my question to people here as well. What are the ways that we can communicate these kind of resources to people? So I think sort of like, and this is where I wanted my talk to actually be short and to have more of a discussion with you. Is we have all these wonderful resources. We have the network. We have resources which this afternoon we are talking about. But how are we communicating these resources to students who need them? And one of the key things really is just in time. So if you sort of like you cut and paste the contact points website, you find that what we tried to do is really to educate not just international students, but really student services on what is the best time to communicate these resources. So what we did with this particular project is we divided into things like fire and safety, your personal health and so on. And so we also advise how student services can actually let students know which period of time. Because like when we did this research, we interviewed international students who basically said, if you're going to tell us about Beyond Blue and about being depressed during orientation, we are not going to listen to you, because orientation is a time when we are most happy. There are balloons everywhere. It's a party atmosphere. Anything about our mental well-being, we're just going to say screw that, because we're happy. So this is also something it's sort of like which is really important to us, that we realize that timing is really significant. Alison has a good question here. Do you know how many students are engaged with the resources? That's actually a really good question. So the way that we actually created this is that we also, Shantan and I actually talked about this. Is this resource for students, or is this resource for student services? Now, if it was for students, we would have had to have $1 zillion more funding in order to get influencers like the Kardashians to to make these things go viral. So what we did was we created these resources that actually are aimed at student services, because student services are the ones who communicate with international students the most. Right, so that's sort of like what we did. But our challenge now is trying to actually get student services to regularly have these resources in as part of their work plan, where at different times of the year they they get into this routine of letting students know. So this is one of the things, right, where where we think about our resources meant for international students, or are they meant for people who work with international students who can actually get these resources out to them? So that's sort of like something that also we can actually think about. And this is kind of like also thinking about outside the box. I mean, I'm really interested in how sort of like there are a lot of tools for international students, like as we all know, right? There are tools when it comes to work workplace issues, like international students not being paid correctly, and and whether or not students are actually using these tools, or should we actually aim these tools at student services so that student services actually push them out as well? Does anyone have any other questions, and we can have a discussion?
We might hold on the questions until the end, Kat, but that's a very, very interesting summary that you give at the end there. We have all of these resources, but are we targeting the right market? So let's hold on. Let's park that idea about what, where should we where should we give the resources to, and who's going to benefit the most from it. So I really like that, and I like to park it. And thank you so much for doing that, from doing the work as well. I just browse it through my phone, contactpoints.org. So I guess that's the takeaway from your presentation. If you are at the moment working with international students in your organizations, go to this website. At least there's a starting point for you to do it. So let's all thank Kat for delivering the presentation, and we are going to have Q&A towards the end. Thanks, Kat. And thank you. That was good. And now let's go to Associate Professor Catherine McPhail and Maddie Stratton to talk about this very interesting initiative that we found, that Karina found. And I said, well, let's get them to talk about this, so safe sex and relationships. I'm going to give you the control of the slides. So if you can let me know which one who's going to do it.
I can do the slides if you like.
Thanks, Maddie.
We're going to share the presentation. So Maddie will start, then I'm doing a bit, then Maddie will go back, but Maddie can be the driver.
I'll be able to read Catherine's mind when she's about to finish, and I can move on to the next slide for you. So that'll work well. Thank you so much for having us join. It's so great to be over in Western Australia, is what I've said to all of my housemates. Just don't mind me. I'm just going to pop over to Western Australia for the afternoon. So thank you so much for having us. My name's Maddie Stratton. So I'm a health promotion officer at the Illawarra-Shoalhaven Local Health District. And I am also a co-leader for the statewide International Student Health Hub, which is a different project, but I thought I should mention that as well. And Catherine, do you want to introduce yourself before I get started?
Sure, thanks, Maddie. I'm Associate Professor Catherine McPhail. I work in public health in the School of Health and Society at the University of Wollongong, and I have a particular interest in mostly sexual and reproductive health. And I come from South Africa, so I'm always interested in I'm interested in women mostly, but I'm interested in assisting potentially marginalized groups of people. In South Africa, I did a lot of work on HIV prevention for young women. I am a spouse of an international student originally, which is how I ended up in Australia. And so I've always, I teach in a program that has a big cohort of international students, or at least did until COVID. And hopefully we'll have again, as international travel is picking up, we are expecting to have a large cohort of international students again. And so I'm just really passionate about sexual and reproductive health, particularly HIV prevention, and working with international students.
So it's no surprise then how we connected and couldn't stay away from each other. We just keep coming up with more projects to do together. But before I get into sharing any of that good stuff, or did I skip through the acknowledgement? There we go. I would like to just take a moment to acknowledge the traditional custodians of the land which both Catherine and I are based at today, and where we live and work. It's the Wadi Wadi people of the Dharawal Nation. Sorry, my dog's in the background. We recognise their powerful connection to the land, waterways and sea, and to community. I would like to pay my deepest respect to elders past and present, emerging, to families, communities and survivors, and to those who never made it home. My dog is also joining in an acknowledgement, of course. And as we're sharing our knowledge today, may we also pay respect to the knowledge embedded forever within the Aboriginal custodianship of country. Let's see how she goes. Okay, so I'm going to go through the presentation today, briefly go through the stages of the wider research project. So that includes qualitative interviews with international students, identifying a need for a sexual health resource, the development of the kit, which is the resource, and we then evaluated through focus groups with international students, informing the refinements and a reprint of the resource. And then the second phase of the kit evaluation included online surveys, which we were then in the process now of writing up. And I'll hand over to Catherine, and hopefully my dog will be quiet.
Thanks, Maddie. So I feel like I'm telling everybody in this meeting things that they already know. That there has been a fair amount of research in Australia which has focused mostly on migrants and refugees, and there's been less attention paid to international students as a population of interest. But the relatively brief body of work that does exist shows that for many international students, their experience in Australia is characterized by arriving with relatively poor sexual health knowledge, and then having struggles with accessing information. And those struggles encompass a range of different things, really about language, but also about understanding Australian healthcare systems, about completely understanding the parameters of their overseas health cover, by having financial constraints. And I think the other thing that's important and that sometimes isn't raised as much is that there's a real fear of the change of the rules of engagement. So I come from one country where this is what the sort of cultural norms are, or the sort of societal norms are around sexual behavior. I'm in a new place in Australia. I know that the rules are different, but I'm a bit nervous of how are those rules different, and how do I behave? Because in many instances, I'd like to explore the differences, but I also don't want to get into trouble. And I think that does come through. And Maddie, if we could go to the next slide. So I was going to say we didn't, Maddie did all the interviewing. We conducted some semi-structured interviews with a group of international students. So we had 28 international students, predominantly female, although almost a nice balance. And these international students had been living in Australia for 10 years or less. And that was a parameter that we put in place when we recruited them. The students that we interviewed came from 13 countries. We will acknowledge that the one continent that we were missing really was Africa. We conducted this research at the University of Wollongong, and I feel like we have a growing body of students from Africa. Obviously, I'm from South Africa, so I'm always keeping a lookout for co-African continent students, and I'm certainly noticing many more African students, particularly in my school. But most of our students in this sample came from Southeast Asia, South Asia. We had a couple from South America, and then from Europe. So Maddie conducted semi-structured qualitative interviews with them, and then did the transcribing, and then we coded and analyzed those transcripts using in vivo. And there were 3 of us doing that, myself, Maddie, and another person who worked in the local health district, who herself was also an international student as background originally. If we can move on to the next slide. Thanks, Maddie. So just to highlight some of the sort of main findings from those interviews. The first was a reiteration of other work that showed that a large number of our participants were concerned about their lack of information and the misconceptions that they had about sexual health from their home countries. And in particular, many of the students sort of made comparisons between the level of knowledge that they might have and the level of knowledge that they could see domestic students had. And they often talked about that being an issue of cultural norms, and I'll talk about that a little further in the next slide. But they were aware of feeling that they had a deficit in sexual health knowledge. We can go to the next slide. And for many of the students that we interviewed, particularly those who came from the Eastern Mediterranean and from Southeast Asia, they talked about coming from countries where there were different cultural expectations, and that those expectations were often to marry quite young, to be sexually abstinent until you married, to have large families, and that there was a general expectation of avoiding sex outside of marriage. And so when they arrived in Australia, they really felt quite ill prepared for operating in a society where there were different options available to them. And so you can see in the second quote that participants explained these cultural differences between their own home country and their experience of what they were perceiving in Australia And what came up often in our conversations with students was shame, that, students felt that it was shameful to talk about sex. It was shameful to seek out information, and that wouldn't be, there wasn't approval for that. And even, I think, even if that approval was distant, it was based in their home country, it was what they had experienced growing up, and so was still a challenge for them. If we go to the next slide. I think a significant finding that came through and sort of echoed the self-doubt and the lack of confidence was that very many of our participants talked about not really having a good understanding of the Australian healthcare system. And I want to say, I've lived here 10 years, I work in public health, I still am sometimes confused by the Australian healthcare system. And so people had a number of concerns. They talked about feeling lost and bewildered. They had uncertainties about language, not just language as in, is my English good enough to discuss these things, but also what is the appropriate English language to talk to a healthcare provider about these issues. A lot of concerns about costs, uncertainty about what was free, what wasn't free, what overseas health cover would cover, what it wouldn't cover, and what resources existed that were cost-free rather than being expensive. They also had concerns about expectations of what healthcare providers would expect from them, and then also concerns about the levels of confidentiality and accessibility of sexual healthcare services. And those were all issues that were raised by our students. So these sort of expressions of being uncertain of their own knowledge, feeling on the back foot in comparison to domestic students, and then being sort of out of their depth in terms of navigating the healthcare system have created a demand for sexual health information among international students. And so when we did the interviews, we talked to people about what were really the things that they were most interested in having information about available. And in terms of sexual health topics, our participants talked about wanting to have better understanding of protection against STIs. I think HIV probably didn't feature quite as high as other STIs, but they were also interested in contraception, also interested in healthy relationships. So I think that echoes their concerns about the rules of engagement are different here. I want to navigate them, safely for myself and safely for the people I'm interacting with. Healthy relationships, and then information about STIs more generally. And I think what was clear is that all our participants knew how to use the internet. They knew they could look up stuff on the internet. But what they wanted was that they wanted to be sure that they were getting this information from official or verifiable sources, so that they were aware that there's an awful lot of junk out on the internet, and they wanted to be sure that the information that they were getting was valid. And in those discussions, they identified both universities and government as sources of verifiable and official language, and also as institutions that really have a burden of care over international students. They are the caretakers of international students while they're studying in Australia. So I'm going to turn now to hand things over to Maddie, who's going to talk about how we took this information from these interviews and then work to develop the kit.
Yeah, thanks, Catherine. So I love hearing a reflection of all of those quotes. It still takes me right back to being in those interview rooms. But basically, we listened. We listened to what international students had to say and what their needs were, and what they identified as potential enablers for those barriers. And we pitched an idea for a sexual health and relationships kit to third-year graphic design students at UOW. The graphic design students came on board and developed the design of the kit, which I have here, and I'll show you a bit more depth in a minute. And the sexual health service, the clinic locally to us, reviewed the content development of the kit. So it was really well-rounded in that way. The aim of the resource is to increase an opportunity for international students to access accurate and reliable sexual and reproductive health information, including healthy relationships, safer sex practices, STIs, all the things that Catherine just mentioned. We use the findings from the interviews. We use the findings of the interviews to determine those key attributes of the kit, and included the topics covered and sources that we referred to there. Once we had developed our kind of first version of the kit, we gave it a bit of a crack. Our first evaluation really kind of made the kit what it is today. It involved focus groups with 13 international students. We obtained their feedback on the design, the inclusions, information, cultural appropriateness, and accessibility of the resource. And you can see the information there. And I'll get into some of the feedback. So the feedback we received from the evaluation focus groups really helped to inform the reprint of the kit, so the version that we see today. In terms of design, participants were really positive about the design. They agreed that the size was appropriate, that it didn't contain an intimidating amount of information. It wasn't an information overload that would deter students from engaging with it. So that was a really important point. Participants liked that it was discreet and that it wasn't immediately obvious that it was about sexual health. There was some really helpful discussion around the durability and usability of the design and the cards that are included inside the design, which then we improved for the reprint. In terms of inclusions, the original version of the resource included a series of business cards that came from the clinic, and they were kind of off-brand, I think I can say off-brand with quotation marks, and most participants weren't in favour of it. They felt like it felt a bit of an extra add-in for the sake of an add-in. So they argued that it wasn't in keeping with the style and the design of the rest of the resource. So again, we listened, we removed that business card and we embedded that information that was on the business card into the design of the kit and referral information in different ways. The inclusions also has an internal and an external condom, so a female and a male condom, and this was really welcomed by students. Most students were saying that it was the first time that they had actually seen a female condom. So female condoms are really hard to access, and we get it, but in terms of giving choice and in terms of an educational tool, that's, you know, why it was included in there. Information. So participants really liked the information included in the kit. They felt the language was easy to understand. It didn't include medical terminology and jargon, which is great because we really tried hard not to do that. Participants wanted more information to assist understanding acceptable relationship behaviour in Australia, as Catherine mentioned. So an additional insertion card was provided by the uni with some material around things like sexual harassment and assault information, which we didn't actually include in our other information. So that was included in the second version. Cultural appropriateness. Most students acknowledged the appropriateness of the colours and the imagery to appeal to all religious and cultural groups, which was great. They described it as neutral, and a really important feedback to us as we, you know, try to remain diverse, representative, and not being off-putting. And finally, when talking about the accessibility, although not an element of the design, but still really important feedback for us as to where the kit should be made available to best reach international students. And I think I can have a sense of a discussion happening at the end of this presentation around that. But participants suggested orientation weeks, events, you know, going back to Kat talking about it being all balloons and all exciting things, and meeting new people and relationships and dating and all of that comes into it. And I think the kit really has a place there at those events. The library, student services, student accommodation as places where the kit should be available, as well as having an online version. So in the second version of the kit, we included a QR code which goes to an online version of the kit as well. So this slide here is what the kit looks like. And I'll give you a moment to have a look at that. But basically the findings of the study really clearly demonstrated I guess the importance of acknowledging different cultures and values and listening to the needs and priorities identified by international students. This study went beyond international students' knowledge and attitudes. There's a lot of literature out there that talk about international students' knowledge and attitudes, and it's so important, I get it, but we really wanted to break that down and have a look at identifying priorities and enablers for international students. We know what the barriers are. We want to work out what it is that we can actually do practically and what we can do right now. And in terms of accessing sexual and reproductive health information. So meeting this need, the kit was developed and evaluated through this co-designed collaborative process with international students. And this is the final design. So this is what it looks like on the outside, and you can see it there in the image on the left. When you open it up, you can see the QR code, as well as having actual service links that you can go through, and those service links go to those statewide services like PlaySafe New South Wales, Sexual Health InfoLink, Relationships Australia, Family Planning New South Wales. And then when you open it up, on the inside, you have the internal or female condom, as well as a PlaySafe branded male or external condom, as well as 2 sets of these information cards that swivel out like this for the information there around sex and relationships and safe and healthy sex. And then to replace those kind of daggy, sorry, no offense to the New South Wales Health Clinic, but they're daggy and they look like the government and they look so boring. We've replaced them with these really bright business cards that are much more on brand and on style, and still has that really important information on there. And I guess the versatility of this resource, I'm conscious of time now, is that it can be added, additional cards can be added to it depending on where it's going to be placed. If this resource is in a different location and, the New South Wales information isn't as relevant, it can be, really versatile in what that looks like. So we are kind of in the final processes of writing up our second paper, looking at the second phase of evaluation on this version of the kit. That was done through a survey with both international students and domestic students, predominantly at a student accommodation location. So that'll be really interesting to hear to see how all that comes together, and to be able to get that out there and share it with this network. So I don't think I have any other slides except for a final slide. That's right. There are details, but I'll pop them in the chat box as well, and I'm sure they'll go around by email. But thank you so much for having us. And I've got some other notes on there saying that it's multi-layered and ongoing and blah, blah, blah. But basically, I think I've said everything I've needed to share, haven't I, Catherine? I've not missed anything.
I was going to say one thing, which was just to say that the fact that this resource is a little kit was something that international students desired, because they were really keen on sort of equitable access. And so they wanted a physical resource that they could potentially use, learn from, and then hand it over to somebody else who might need it.
Yeah, actually, that was I feel as though that's almost another paper in itself, is that paying it forward model of international students. And it's always, yep, I've got this information, but I know somebody else who actually really needs this information because they've started dating, and I think this is going to be really helpful for them. And it's that real sense of community that I love about the international student community. So yeah, that's a really good point around that pay it forward model. But I can see in the chat box.
Thank you so much for that, Catherine and Maddie. There's plenty of conversation in the chat box.
Right. I'll jump in.
I just can't monitor everything, but thank you so much for that. And I like what you said about the resource kit being in a fist, like our phone. Our phone fits in our palm. And it reminds me of a student comment that some international students attend orientation with their parents or guardians, because it's very hard for parents to let go of their child. And having something that is quite small and quite discreet that can be easily sneak into the back pocket.
And I think as well, one of the comments, there was some real discussion in those focus groups around whether or not they should have any words on the outside, but there are no words on the outside at all. So really, you don't know what it is until you open it up. And you can open it up, close it again, pop it back in your pocket, have a look when you get home, or you can open it up and have a discussion with your folks if that's what you want to do. But I also wanted to say, in the second version of the kit, along with the QR code, we also added the pride flag in there, and that was recommended from international students as well. So really great to be able to add that and include that. There are lots of things that we would love to include, like dental dams, but I'm not sure exactly how I would be able to make that fit, but we'll see what comes out of this second phase of evaluation. Hey.
Absolutely. Thank you, Maddie. And it really stressed the importance of ongoing, not just one-off, ongoing
Absolutely.
improvement, evaluated and all that. Thank you so much for that presentation. I wish we have it here in Victoria, but we don't.
We'll see how we go. I'm going
Thank
for
you.
global domination.
Oh, absolutely. I mean, that's why we are here. Thank you again, Maddie and Catherine. And I'm going to give the floor to Dr. Jian Tran from Multicultural Center for Women's Health, who did a study about is it domestic violence or for female international students. So, Jiang, I gave you the permission to share your screen. So, if you want to do that.
Can you please stop sharing from yours?
Yes. There you go.
Okay, I'm going to share from mine. Yeah, it here. Can you see it?
Yes, we can.
Okay, yeah, cool. Thank you very much. My name is Zhang Chen, a research advocacy and policy officer at the Multicultural Center for Women's Health. So thank you so much for the opportunity to share our work in this meeting today. And we are going to talk about some findings from the study, help-seeking experience of female international students after sexual violence and intimate partner violence. Actually, this study is a part of larger research project. I'm going to talk more about that in the next slides. But before I start, I would like to acknowledge that the traditional owner of the varied lands of which we are all zooming today. I'm zooming from the unceded land of the Wurundjeri people of the Kulin Nation, and I would like to pay my respect to their elders past and present. The INVEST project is a larger project. The finding that I will be sharing today with you all are the other part of the INVEST project, which is funded by Australia Research Council and collaborated among Multicultural Center for Women's Health, the University of Melbourne, Monash University, Deakin and Safer Family Center. So this is an ongoing project. So there are three phases of this project, and Multicultural Center for Women's Health has conducted the second phase and looking at the help-seeking experience of female international students. So for the literature review, I am sure all you here all know about that. So little is known about the lived experience of female international students who suffer from SV and IPV, and they have seeking strategy and their support need. But what we do know is that the structural and systemic discriminations associated with migration and international student status puts female international students at risk of experiencing sexual violence and intimate partner violence. Further, they have seeking experience influenced by many factors related to migration issues and international student status. For all of you here know very clear about that. For example, the systemic barrier, including visa status, economic difficulty, and limited employment, and lack of culturally safe and linguistically appropriate services. So given the gap of the literature, the aim of this phase 2 is explore the way in which female international students seek help and support after experiencing SV and IPV in Australia. So in particular, we aim to identify barriers, prevent them from seeking help and what their support needs. So from August 2021 to June 2022, during lockdown, we conducted in-depth interview with 30 female international students from 15 countries who all experience SV or IPV while studying in Australia. So because the sample of this study is small and the findings of this study cannot represent the experience of all female international students who suffer from sexual violence and intimate partner violence in Australia. However, we believe that the findings will provide us better understanding of the specific support needs of female international students, and it could offer significant and broader implication for policy and practice. So in the next slides, I would like to share some findings related to barrier of seeking support. I will then talk about the ways they overcome the issues and the preference for social worker and health professionals from similar cultural background. In the first one of the barrier faced by female international students has been found from our data is being socially isolated. I think similar to the last presentation, and socially isolated from the existing healthcare and service system. So many participants said that when things went wrong, they knew nothing about where to go and what service were available for them. For example, you can see from the first quotation, and even though these students were from an English-speaking background, it was still difficult for her to navigate the health system and seek help for her health after experiencing sexual assault. I asked her, I thought that your insurance covers GP service, and have you ever tried to book GP? And she answered that I didn't even know about GP until Uza told me about that. So we can imagine for international students who from non-English speaking background, the added barrier of language and communication might add more challenges for the students to find and access local services. So in the second quotations, this student experienced IPV and had to manage the symptom of diagnosis of sexually transmitted infection. She couldn't find any service around her at the time. And in the interview, she disclosed that she had to deal with everything on her own with limited support. The feeling of loneliness were mentioned very frequently during her interview. And after suffering from anxiety, depression, and pain for a long time, she finally found a sexual health clinic nearby and got treatment. So the lack of familiarity and knowledge of existing healthcare and service system in Australia result in the inability to link in and to connect with local services. So as a result, the participant here either deal with the issue alone or delay seeking help. In the second one, related to barrier of seeking help, I would like to share unavailable, inaccessible, and unaffordable support services. During the interviews, our participants were overwhelmingly described the costly services and long waiting time and the lack of university support arrangement when they need support during the tough time of FV and IPV. In the first interview here, the participant experienced sexual assault and she went to see her GP, but did not proceed with mental health support just because it was too expensive. So in the second example, the student suffered from sexual and financial abuse by her partner and who also her boss at her workplace. She had unintended pregnancy, gave birth, and was raising the child on her own. At the time of interview, she was in an extremely hard situation of financial stress. And after a long and complicated journey of seeking support, which involved accessing Centrelink, legal service, and domestic connect services and health professional. So the findings here reinforce the support service system issues in Australia related to long tiring process, costly services, and international student insurance policy. The structural and systemic barrier issues were found to be significant, prevent the female international student in this study from receiving appropriate support after FV and IPV. However, from the interview, we also found that the female international students demonstrated an incredible ability to find different ways to deal with the issue and to look after their health. For example, in the first interview, the student sought help by flying back to see her health professional from her home country. And because she said that here I'm a bit lost in a matter of who I can talk to. And in the second one, the students faced with the structural barrier related to costly services. So she booked appointment online with her health professional back home. And she said, that's because it's cheaper. And another finding we would like to share is I think the last, I picked up to share with you all today. Yes, preference for social worker and health professional who come from the similar cultural background. So during the interview, the benefit of being connected to social workers and health professionals who are from similar cultural background has been found. So in the first interview itself, these participants shared her positive experience with her social worker who support her during the difficult time of intimate partner violence. So she talked a lot story related to the positive experience of during the time the social worker helped her. And in the second example, the participant talked about her experience with health professional who came from different cultural background. So because the cultural difference, the doctor was focused on the other things rather than her main concerns on issues, her issue related to sexual health because she suffered from sexual violence. So while the participants here study and communicate in English, language and cultural barrier was still reported as a significant factor prevent them to accessing support service after HV and IPV. So for many participants, the comfort of being able to communicate in their first language was one of the most important factors in terms of feeling supported. So from the based on the finding, we would like to highlight that the structural and systemic issues continue to put female international students at risk of seeking help for HV and IPV, and the issue from prevent them from achieving appropriate support. And the finding also suggests that cultural background and language are important factors for female international students when it's come to accessing support that is tailored to their needs. And our recommendations are the first one, very a need to enhance support services which is tailored to female international students in appropriate ways, both within educational institute or broader community. And the second recommendation we would like to highlight is a formal support services, including the service in university, need to consider their policy, recruitment, and workforce so that the staff are adequately represent the community that they serve. So I think that's all for my presentation today. I ran very quickly at the time, and thank you for listening. I'm going to stop sharing now.
Thank you so much, Yang. It's a really it's heartbreaking to hear that this is still happening. I think from some of us who were an international students, I was an international student in the late 90s. We had this issue back then. We tried to address it, and then 20 years later, we are still having this issue. So it does requires us to all working together to address the systemic barrier instead of just having a band-aid approach. And that's what we hope to achieve from having committed individuals such as yourself and all the other great presenters and everyone that attend here to make that systemic change and to work together to push towards that systemic change. We're going to have a 5 minutes Q&A. We always run over time doing these things. So if you have any question to either Catherine, Maddie, or John, please unmute yourself, or you can put it in the chat. And I'm trying, Karina, can you browse through the chat and see if I've missed a question?
I might just speak now.
Is it a question, Ali?
I just wanted to say thank you to everybody for presenting. And would you be happy if we shared that on the COPAM website? Because there are different hubs and things around, but I just think the more avenues people that work with international students can get to this information, the better. So if you're all happy to share your information, research, resources with us, that would be fantastic. Great.
Okay, thank you. Thanks, Ali. Jiang, I actually have a question because when you talk, and it reminded me of a case where international student was the female international student who brought her husband with her. And her husband couldn't get a job here, experiencing high level of stress, have a mental health deteriorate, and resulted in intimate and partner violence. So I'm just wondering. My question to you is, I'm wondering, when we talk about female international students, we often assume that the perpetrator of violence is an Aussie, right? It's like a local person. So I'm just wondering whether your research found that intimate partner violence is more complex, that the perpetrator can come from different backgrounds and sometimes their own partner that they brought that come with them from overseas.
Thank you for the question, Bodhi. Yeah, in the interview with 30 participants, we have some participants suffer from sexual violence and sexual assault, but the main part of the participants suffer from intimate partner violence, and the intimate partner actually Aussie, yes, Aussie, but some of them come from their own country but have citizenship here. So I think one of the other findings emerged from our data is the perpetrator that also their boss at workplace, also the person who citizenship and marries with them and have baby, and after that maybe it's like domestic violence and they suffer from that, and the perpetrator that like stop the relationship and have another relationship with another lady. That happened. That what I heard from the conversation the women share with me. I think it's heartbreaking data, and a lot of participants, they share with me when they were in the shelter with baby 6 months or 1 year, and during the interviews that they hold the baby in the hand and in the very tough conditions suffer from sexual violence and intimate partner violence, and they almost very young, and just like came to Australia to study, and maybe it's like the intimate partner violence, intimate partner from Aussie background or their home country background, but have whole citizenship here. Thank you.
Thanks for that, Jian. It really shows the complexity that we can't have that one size fits all approach, that everyone has their own story. Asha, please unmute yourself.
Yeah, I'm struck by what I'm hearing here and what we're seeing through the intake assessment and referral service. The Study New South Wales funds our organisation to deliver that. We've been working with the students for this our 3rd year. What I'm struck by is that we have these bits of research, and I'd really like a national study. And we've got more than half the students with complex case management in our service are intimate partner violence, and I'm wanting us to get this body of knowledge and advocate for prevention, early intervention, and an integrated service. And we've been fighting for an integrated service now for 2 years, where we just don't have the funds to do the prevention and early intervention. We did have, while the hub was funded, the International Student Hub, that City of Sydney funded, and I think every city needs to have one that's student-led. So this was led by students. They designed the Welcome, Support and Justice initiatives. And honestly, some of the most complex, and I used to be a domestic violence specialist counsellor, some of the most complex domestic violence cases have been these international students, and finding services for them and legal help. We've got victims who've been charged as perpetrators. Like, who the F is doing the work to get funding for this is my question, ultimately. I'm sorry about the F.
That's okay, Asha. It is December. I have dropped F-bombs left, right, and center because I'm tired. It was the end of the year. But that's really a good question about who's supposed to fund this. And there maybe that's something that as a network we will take away. We will have, we will think about that, and also our role as a network about advocacy on a higher level. So thank you so much for that, Asha. Danielle.
Thanks, Buddy. Sorry, my camera's not working. I just wanted to thank everyone so much. That's been incredibly insightful. I'm currently the Vice President Professional Development with ISSHN, and I would love to share this recording with the ISSHN network if everyone is okay with that, because I think there's been some really useful conversations. I think the big $1 million question is, how do we get this out to students? Because there's some great resources and there's been great work that's done, but how do we get this information out to students, particularly as we're seeing a deterioration of the specialised support for international students? So it's sort of like, you know, the one size fits all, you know, one student's the same as every other student, which is what an approach a lot of the education providers are taking. So that's quite concerning. And I'm seeing it at some of the places where I've worked. So yeah, just definitely, how do we continue the conversation so that, as you said, Woody, that we're not talking about the things that we were talking about 20 years ago, that we're actually moving the conversation forward. So definitely would be interested to sort of see how ISSHN can support that conversation as well moving forward.
Absolutely. Thank you so much for that, Danielle. And also kind of linking it to what Catherine and Maddie and even Kat was saying, you know, information is key, but are we targeting the right people? Are we providing information in the right place at the right time? And also who's responsible for distributing that information? So all of these presentations are linked to how do we make sure that international students are aware and also know the services that is actually out there. Catherine.
Thanks, Pudi. I just wanted to draw attention to a comment that Maddie's put in the chat, was to talk about the International Student Health Hub that Maddie's been working on, which is an online resource, again, done with a lot of consultation and co-design with international students, that provides a whole series of bits of information about sexual and reproductive health. Maddie, I should hand over to you. You should explain it.
No, that's okay. So that's with my other hat over is International Student Programs co-leader for Play Safe programs. If you haven't heard of it before, I can send around some information, which would be great. But yeah, this was our a really big piece of work and something that we're really proud of in terms of consultation with international students ongoing, and it's an evolving piece of work. It's a website that keeps growing and growing and including more sexual and reproductive health information. We're looking at adding a new page around consent and relationships, adding some more information up there about related health screening and things like that. But I guess the most popular pages on that website, just to take 30 seconds here, is Overseas Student Health Cover page, which has we've been working with all the overseas student health cover providers to develop that page, because nothing really existed. It's in lots of different places, but all in one place. So that is a really, not surprising, a really popular page on the hub, as well as the Australian healthcare system page, and we've talked about that in everyone's presentation really. So that's a page that I can see evolving a little bit more to what it is currently. But yeah, I've added the link in there in the chat, and I'm pretty sure it's been presented at this network in the past. So I'm sure you're aware of it. But yeah, just to say it still exists and we're still evolving and growing it, and it's happening and it's exciting. Yeah.
Thank you so much for that, Maddie. Yes, we have presented this in the network, but also going back to what Asha and Daniel was saying, you know, let's do a national, federal kind of level instead of state-based levels, because international students are mobile population. We move around, so we need to have a centralized strategy. Now, I promise you a break, but I'm looking at the time. It doesn't seem that we are going to be able to have a break. So I hope you're okay with that. If you need to go to the toilet, please go to the toilet. That's always my catch-all. I need to go to the toilet. But we are going to keep moving, and we are going to talk about the latest release from COPAM. This is just this morning, Karina. So I don't even know what you're talking about when you send me the email. So please enlighten us with the latest news from COPAM.
Thank you, Budi. Would you be able to share the slides again on your end? It's just a little bit of a it's an image on there about what we've created. Excellent. Thank you so much. So thank you everyone for joining us today. It's been really great to put some faces to names, and again, a fantastic discussion and presentations from everyone today. I just wanted to launch a new HIV health literacy guide. So I'm coming today to you from a project called COPAM, and that's a community of practice for action on HIV and mobility. And what we do is work to facilitate discussion and activity around Australia to ensure migrant and mobile populations are on the HIV response. So over the past couple of years, we have been working on some resources and guides to help people who are working with migrants and people from culturally and linguistically diverse backgrounds in Australia. And this guide has been developed to help people working with those populations in preventing and managing HIV. So in a nutshell, it contains information, practical tools, and quick links to assist practitioners in planning, implementing, and evaluating culturally and literacy appropriate HIV information, education, and communication resources. There was a process of development, and it involved a literature review and interviews and focus groups with people from communities in WA. And we pulled out the learnings from this process and found some recommendations on how to improve and design and disseminate HIV information. We found a lot of the existing resources were problematic in terms of accessibility and appropriateness to the target audience. So the guide provides some quick and easy steps on how to address this and a little bit more. So it does have some relevancy to other health issues that are applicable to migrant and mobile populations. So please feel free to download and share this resource with your networks. I'll just pop the toolkit link in the chat as well, but we will share links that were shared today, including this toolkit at the end of the session, in a few days with the meeting minutes as well. So you won't have missed any of the links or the fabulous discussion we've had today. So thank you. I can hand over to Ali now.
Thanks, Karina. So we are going to keep moving so we can finish on time. And Ali is now going to provide us with an update. They've been working with a working group to review the deed agreement between ISSHN providers and the federal government. And Ali is going to take the floor and guide us to what they've been doing. You have 5 minutes, Ali.
Fabulous. Okay, I'll be very, very quick. So I guess in a nutshell, we had formed a working group. So I just like to call out to everybody that has participated and we've been meeting regularly. So people have been giving up their time, their expertise and sharing their knowledge and case studies. And it's been quite a harrowing process in a way, because we're looking at something quite big. And this also relates to, I guess, the network taking a bit of leadership on that sort of strategic level. Okay, so we were meeting really to develop up the deed, but it's quite a big encompassing process. So what we did decide to do in the immediate sort of coming up on the 14th is that we are putting in a submission regarding women's health. So did you want to just put the recommendations up? Oh, there's no recommendations. Okay, that's fine. So what we decided to do is we decided to put in a submission to the, there's a committee that's been put in. They've requested input on sexual and reproductive rights of women in Australia. So of course we've decided to focus on international students, and we have of course, because there's a plethora of issues, and we've heard some of those today. These issues haven't gone away in all the time that I've been working. So some of the key things we're asking for is we have asked for a waiver for the 12-month waiting period for access to sexual and reproductive health. This is just off the top of my head. I don't have the notes in front of me. And we have also asked for, looking at the cost effectiveness of it, and that we have pointed to our deed Oh, thanks, Karina. We have pointed to our deed submission that will be coming up that will sort of tackle a lot more of these issues in greater detail. But really, and we did touch on sexual assault, so it was really good to hear that earlier. So we did talk about sexual assault, and we really want to frame things, any education that comes out for international students, in that real prevention space. So, you know, and I guess my work is that a lot of people come to Australia, again, you know, rehashing what we've just heard, not understanding what is appropriate, what's inappropriate, or having very set sort of views regarding sort of, you know, we all live in a patriarchal society. How that plays out in different cultures is quite different, and how do we manage that for students here? So some of the so these are the list of recommendations. We've got a really short deadline to put these in. And so therefore, with this process, which isn't great, is that we are just looking at what the input from the working group, which was decided by the rest of the group. So I guess and that's how we're working it. Further down the track, we will hopefully have better timelines and be able to actually give you the document to take back to your organisations for endorsement, at least certainly the recommendation component of it, which, you know, your organisations would be most interested in. So I think that's a process that would be better. At this stage, we have just listed the 3 co-chairs and the network broadly. Also, to mitigate, there is risk for some of the workers that are part of the network, and making sure that they're safe to contribute with all their expertise, but there's no sort of backlash from their own personal organisations, depending on what is said. So as you can see, some of the information there, like I've just talked about the information, and going back to what Kat said and what we all know is that, yes, it's good to provide information at orientation, but actually it's not. It needs to be ongoing for that first 12 months. And if you're looking at the data around bloodborne viruses, sexually transmissible infections, we're looking at that sort of 12-month and beyond is where the real risk is. So what we're hoping is that if students have information ongoing for that first 12 months, they will have better resources, be much more equipped to know actually how to navigate the system, where to seek help from, and get the information that they actually require for their issues. So that's what we're hoping. And like I said, the last bit there just points towards the fact that we are doing a deed. That is taking us quite a significant component of energy to put that in. One of the interesting things that we have done is we do talk about human rights in our both in this proposal and in the next proposal, and that was something that was brought up by ISSHN, I think, and a really key and important aspect of reframing how we think about this work, and also not looking purely, and of course we will be mentioning the economic value to the country of international students, but actually weighing it up with some of the other issues as well. And also knowing that Australia is a signatory to the so the Convention on the Rights of the Child, and we do report on that. So these students are actually in our care while they're here. So do people have any questions? So that was very quick, Woody, see? Does anybody have any questions about the proposal, the submission?
So I might just ask Karina to to unmute. So Karina, if people want to see this proposal, where can they find it?
So we have popped it on the COPAM website. I will just pop in the link in the chat. Please note it is in very draft form, and we will be making some refinements, but yeah, in its draft form, it's available to view on the website. Just at the end of this page here, it says, please access the draft.
Great, thank you, Karina. And Ali, if people want to have a read to it and left some comments, how long do they have to give it to you?
Okay, so this is the problem, because we've got quite a tight deadline. So if people can send through any comments, but the comments we really want to hear from this is a short submission, so keeping in mind this is a very short, snappy submission. So of course, it doesn't include anything, but if there is something in there about reproductive health that we have actually just completely missed, that is critical to this issue, we would love to hear from you. But we're actually going to say, so what's today? Wednesday. So if people can give us that feedback by Monday, that would be good. So it's a very quick turnaround. But we're not expecting there to be any real big challenges with what we've said. It's pretty sort of standard. It's everything that we all know that we've been talking about for ages. It's just put together in a very succinct, quick way. And we are working on our references and including all the amazing reports and things that we've heard from and that we know of from around the country. So, yeah.
Excellent. Thank you so much for that, Ali and Karina, for the great work that the two of them has been leading, and members of the working group as well. I removed myself from the working group because I simply had too much to do. So it's good that the things are progressing. And if you also want to put it in the chat or maybe unmute yourself, because I'm aware that a lot of organizations are actually putting submissions to this Senate inquiry. So maybe if you like to share about your own organization submission, and a lot of these submissions hopefully are to complementing each other instead of them being separate from each other.
Yeah,
Yes.
we're working on one now. Sorry, we're working on one now, and it will, because we gave quite a bit of reporting to this working group, we'll be making sure that it aligns to what's in that as well.
Great. Thank you so much, Asha.
Fabulous, Asha. So I guess going down the track, because there will be opportunity to comment on more submissions and the deed, of course, coming up next year for us. It would be good to think about a process by which we can actually list organisations that are part of the network. And I know this is problematic because currently what we do say is we've got the 3 chairs and we say the network, and we say that that is made up of 50 participants from across the country, from, you know, researchers, universities, direct service providers, health workers and things like that. So I'm thinking if we want more leverage with the Commonwealth going down the track, it might be worth us actually being able to have a little precursor to take back to our organisations, so they're happy to stick either their logos or, you know, more officially recognise their participation in the network. So I think strategically that's the way we want to go forward.
Right. Thank you so much, Ali. And we are actually running ahead of time. It never happened in any of my meetings before. So are there any burning topic or burning question that you want to ask one of the presenters that kindly share their work with us today, or any general comments that you want to make about sexual health and international students? I just want to say thank you, Maddie and Catherine, for giving me another lit review to add to my list of my own research. So thank you for that. Now I don't have to look far. So if there is no other comments, I also want to stress thank you so much for being here this afternoon. 2022 has been a busy, chaotic year. And that's I have a very strong feeling that's because we had an interrupted 2020 and 2021. And this year felt like they're catching up, and we had to run a marathon in the space of 5 minutes. So I'd like to thank you all for coming this afternoon. I also want to congratulate you and also commend you for all the work that you've been doing in your organization as individuals as well. When we put all of our thinking together, we are actually benefiting international students, and we just have to keep that the focus of our approach. What we do is to benefit the students. So thank you for doing the work. We are going to meet again next year, maybe in May, maybe in June. I'm not quite sure. I'm going away for 6 weeks, so we are going to do it after I'm back. And we are going to keep working on the review of the deed agreement between ISSHN and the federal government. And we are aiming to submit that by June 2023. And also, please check your emails for any updates. on that note, thank you for being here. And of course, Happy New Year. Yeah. God, where has the year gone? We are nearly there. So thank you so much for being here and wish you well and see you in the next year. Bye for now.
Great, fabulous. See you guys. Bye.
Thanks. Bye.
All good, Karina? You might want to stop recording now.
Great.